be presenting with Abina, who has been shared, is a caregiver advocate, but also part of our Cancer Caregiving Collaboratives Executive Committee. And so over the past year have gotten to work more closely with her. And I'll get us started. I want to share information about NAC, our research with cancer caregivers, and then hand it over to Avina, who's going to share her caregiving story and how she's turned her experience into advocacy. Yep. Let's see. Before I get started, NAC is a membership-based organization. We're focused in transforming how the U.S. recognizes, supports, and values the 53 million family caregivers in the U.S., providing complex care. And we do this through research. We have a policy and advocacy arm or team. And we also want to drive policy, system, and culture change to really elevate family caregivers as a national priority. Here on this slide to your, right on the left side, you see the different, the diverse group of members that we have, both in the nonprofit and for-profit space. Our organizational priorities are listed here. We look at the well-being of the caregiver very comprehensively, and so we want to focus on caregiver health and wellness, promoting caregiver financial well-being, fostering caregiver-friendly communities, and building equity and inclusion throughout all of this work. And to advance our first priority, this summer we launched a large initiative called the Cancer Caregiving Collaborative, which I'll discuss in more detail in a bit. So perhaps you might have heard of the National Alliance for Caregiving. We published a study that's called Caregiving in the U.S. in collaboration with AARP. And it's really a landmark research project that has been tracking the challenges and opportunities of family caregiving since 1997. We publish it about every 5 or 6 years, and it really provides valuable insights for policymakers, advocates, researchers, healthcare leaders, and caregivers themselves about who are the caregivers in the country, what are they providing, how many hours are they providing care, what kind of tasks are they doing in their care, and more importantly, really looking at how is the care that they're providing really impacting different aspects of their lives, their health, their well-being, their financial health, among other things. And the latest data that we have is from 2020, where we know that 1 in 5 people are providing care to someone with a chronic illness, disability, or an aging-related condition. We are gearing up to release our 2025 data in the next summer, and so stay tuned. We'll have an updated number for everyone and just updated data on that. So we know that family caregivers are really the backbone of our health system. They're providing complex care, including medical tasks, emotional support, and at the same time, their contributions are really often overlooked and undervalued in our society. And so while they're providing their caregiving is becoming more prevalent, it's becoming more complex and more intense, we also see that those from diverse backgrounds, caregivers from diverse backgrounds, face additional challenges, that they may have limited support services, resources, and then that in turn exacerbates health and economic inequalities. And so while caregiving is essential and is present in all of communities, we know that some communities face bigger burdens and their experiences very unequal. So a little bit more of facts painting the picture of who are the cancer caregivers. So as I mentioned, we do the Caregiving in the U.S. report every 5 years. In 2015, we took the data and we zeroed in on cancer caregiving and what does that look? Who are the cancer caregivers and what does that look like in the country? And here in the slide, I won't go over all of them, but you can see, I'll point out a few things about the cancer caregivers. we see that similar to other caregivers, women tend to be playing this role. There's also, on average, half are employed, and so you have family caregivers who are juggling both the care for their family member or friend and also being employed full-time or part-time. And then about 39% live with their care partner and recipient. This is important because if they're not living in the same household, then there's additional logistical support and, of course, time that goes into the providing care. And not listed on this slide, but one of the biggest takeaways from this report that I'll go into in the later slides is that providing care for someone with cancer is intense and a short-term episodic experience, and that cancer caregivers are providing care for an average of 2 years, typically due to the recipient's passing or remission. And however, the cancer caregivers are facing significantly challenges in this experience. So this is emotional distress, physical health issues, financial hardship at a much higher rate than other caregivers. And I'll delve into quantifying, the impact of that. But at this point, I want to turn it over to Abina, and today I have the pleasure of having her present with me. But when she is not able to do that, I like to share this quote that really highlights the nature of like the cancer diagnosis and the immediate impact on the caregiver, which this quote really highlights. The doctor said to me that my life was going to change pretty significantly, which I thought was a strange thing to say to me when my husband was the one that was diagnosed. I didn't realize it at that time, but I became a caregiver from that moment on. And so really thinking about, I'll let Abina kind of share more about her story, but I think, again, this quote really highlights kind of going through to me, the experience of becoming a caregiver. And when that caregiver says like, oh, like so focused on the person with the diagnosis, my family member, that, in retrospect, that's when my life was going to change. And I also like this quote to share it with folks who are clinicians or in the healthcare space, because I think that this physician recognized the role of caregivers and gave her a heads up about what was to come. So with that, I'll stop sharing my slides so that we can see you, Abina.
Thanks, Yadira. So hi, everyone. I'm really grateful to be here with you and to have an opportunity to share a little bit about our family story. So I guess I'll just go back to the beginning. My late husband, Joseph Buckley, this past September was 7 years since he's been gone. And we were married just a few months shy of our second wedding anniversary, and we're expecting our first child. And I'd gone away on a baby moon trip when he had a massive seizure. And, we certainly couldn't have imagined it at the time. We thought there were other explanations for what it could have been. And so, to go to the hospital and we're hours away from home on what was meant to be a really magical time. And then after a couple of hours of scans and different doctors coming in, which of course at the time I really didn't process why. First there was a tech who was doing it, then there was another doctor that came in, then there was another doctor that came in, and then all of a sudden they tell us, well, he's actually got a brain tumor and it appears to be actively growing, and your lives are going to completely change. It really was surreal. And to Yadira's point, that doctor was giving me an incredible heads up, and I still didn't know what it meant. In fact, I didn't connect to the word caregiver for many years because I was focused on my husband. This awful thing had happened to him. And they were very clear with us from the beginning that he was only going to have 5 to 7 years to live. And so we didn't even have the luxury of thinking, well, people get cancer, we'll go through treatment and then we'll be fine. Um, they could tell us very clearly what the trajectory was going to be. Obviously, they couldn't tell us all of the exact time frames, but um, we understood what we were working with from the beginning. And then we went home and he went on anti-seizure meds, and they gave us the opportunity to have our first child before he started treatment. But 2 weeks after our son Thomas was born, we were driving up to John Hopkins Hospital for his first scans, and then for him to start 5 days a week radiation treatment. And that was for 3 months. So for the first 3.5 months of our baby's life, that's what we were focused on, and it it came with so many emotions, but frankly so overwhelming that I'm not sure we allowed ourselves to really go there, because here we are becoming new parents, and we don't really have. I mean, we had those first 2 weeks, and then that was it. We had to focus on other things, and that first with the radiation treatment, and then the chemotherapy treatment that took us all the way through the first year of our son's life. And the way we got through that time, because, here I am, new mom, first time mom, my husband's a first time dad. We both have full time jobs. And, we live in an apartment in Washington, D.C., and the best doctor is in Baltimore, Maryland, including our neurosurgeon. And we only made it through that year because he had a leave donation program at his job. He worked for the DC public school system, and they had a leave donation program. And I worked for the federal government, and they had a leave donation program as well. And so people donated time to us to make it possible that I could take off the time that I needed to both be taking him in for treatments as well as caring for him at home. And we had his parents who were retired and had already offered to take care of our baby when I had to go back to work, which was after the first 4 months. And so with the leave that we had, we were very fortunate because it meant that when I did take time off, it was covered, and we were able to manage that way. And he was also covered during that time. And so we did that for a year. And then he went into remission. And for, I think, almost 2 years, his tumor wasn't growing. And we're doing our best, but still, frankly, living with the effects of cancer, which is on a quarterly basis, going up to Hopkins, getting another scan done, all of the anxiety that comes with the beginning of that, the actual day of the trip, what comes after that while you wait, all of the anti-seizure meds that he had to be managed, the supplemental medications that he had to have to deal with the effects of the treatment that he had received, as well as me just making sure that he was getting all of that stuff done, and we were staying on top of everything we needed to, including our bills, that just kind of kept coming. And then we got pregnant with our second child thinking, okay, well, it seems like things are going pretty well. But then his tumor started to grow again during my second pregnancy. And at this point, he was at a stage 4. So we knew that it was going to go relatively quickly from that point. And we still did everything we can, access different doctors. We were told to look into clinical trials because he'd done radiation twice at that point. And so more treatment, had another baby. The morning that I went into labor with my second child, he had another massive seizure. And we had to thankfully have friends who were on standby. And one came to sit with our older son, and the other came to the hospital with us because my husband couldn't talk but didn't want to miss the birth. And so we had another child. And as soon as I was out of the delivery room and into my own room, immediately called our doctors and started scheduling appointments. And he survived for 10 months of our second child's life. And so his whole journey was 4.5 years. And we basically, it felt like lived in sort of an emergency state the entire time that we were in this journey. And in the final stages, when it was very clear that there was nothing more they could do. They were doing surgery upon surgery to try to catch up with the growth of the tumor. We brought him home to do hospice at home for 6 weeks. And I really didn't know what that would entail. I just knew that he wanted to be home and he wanted to be near us. And so we brought him home. And once again, I had to stop my job, thankfully, more leave donation, because I essentially had to take care of him round the clock while taking care of our older child as well as our youngest, until he passed away. And we had nurses coming in here and there to check in. And I had to also separately pay for a nurse to stay overnight on 2 nights where I just felt like I couldn't keep up this cycle of being up for my husband and then up for my baby over and over. And then he finally passed away at home. And we were very fortunate in some ways because I was able to be there for him in ways that were important to me. And it was also incredibly difficult. And with all of the support that we did have, it I can't even fully describe what it was like. And I'm glad that we were able to do it the way that we did it. And I still feel like it wasn't enough because here he was suffering and knowing that he was going to have very limited time with us. And I still had to function as, his caregiver and the children's mom and our life administrator and hunting down insurance companies on all of this, which completely took away from the limited time that we had with him. And I just wish it was different, because if my situation was really privileged, I cannot even imagine what it's like for people who don't have the resources and the support that my family had. So apologies, I always get emotional. It's been 7 years, but it still really affects me when I get to talk about it. It was a very, very hard time, and I still feel like, wow, thank God that I was able to spend the kind of time that I had with him, and we were able to have him home and have him be with his family for as much time as possible, because that's what mattered to us. And I know that's what matters to so many caregivers out there, and not all of them are able to do it that way. So I'll stop there, Yadira.
Thank you, Abina. I think it's so, thank you for sharing your story. I think every time I hear it and learn a little bit more, just I think learning really keen into what, it is to manage all of the caregiving tasks and roles that caregivers are asked to take upon while life is continuing. And I think that that's a really important and powerful message from the NAC perspective. It's really important for us to share not only the data and the research, but also how the real and unique stories of family caregivers and the intersection of not having, paid leave or having that, and what does that mean, and whether it's sufficient in cancer, having family support and available when it's needed for cancer caregiving and other caregiving roles. And so your story really highlighted different pieces of that. So I'll go back to sharing my screen and invite you to chime in, Abina, at any point, to really kind of talk about these different data points and from the caregiver and the lived experience perspective. And so here, I want to point out, I'll go through these quickly because I want to go into the Cancer Caregiving Collaborative work. But the intensity of cancer caregiving in our caregiving in the US, in our cancer report, we go about quantifying it and how many hours caregivers are spending providing care. And similar to other family caregivers, we know that they're putting in a lot of hours and stepping up for their family members in many different ways. Want to point out that we see for cancer caregivers, they're providing significantly more hours of care per week compared to other caregivers, and about a third are saying that they're providing care for over 41 hours a week. And so that means that many are juggling, again, a full-time or a part-time job in this caregiving role of 40 hours plus or plus. We also see that cancer caregivers experience higher rates of emotional stress. We see that about 50%, so the top bar reports significant distress compared to 37% of non-cancer caregivers. And then additionally, that 52%, at least in this survey, said they had no choice to become caregivers. And 41 expressed a desire for receiving help to manage their emotional and physical stress. I think the one thing that we're really focused on as the care the care that caregivers are providing is becoming significantly more complex, and they're doing a lot of medical and nursing tasks for their care recipients, often with little or no training for these tasks. And so some examples of these tasks may include, managing incontinence, preparing special diets, using assistive devices, managing complex medication regimens, and others. And here on this graph, you see, who is reporting doing these tasks, taking them on, and whether or not they receive preparation from the healthcare team. And this is a number that really needs to change, because if imagine the pressure of having to take on this role without not being confident or not being adequately prepared to do it, and how much pressure and emotional stress that adds to not getting something right. And so we also have caregivers who often talk about that, as well as the added pressure.
And Yadira, I would like to add to that piece as well, because that was true for our family pretty much from the beginning. And it was much more intense when my husband was home for hospice, where I was having to check his blood sugar all the time before he ate, give him his meds, and it was a different sort of cocktail of meds, manage his pain, and not be able to make changes myself, but have to call people in. Just there's so many, changing his, when it came to his, he had a catheter originally, and then that wasn't working out. So then making sure that I was on top of, things like changing diapers and all of that. And before that, it was just tracking his seizures and having the right information to give the doctors and being able to write it all down, along with managing our lives. And really, there was no choice. It had to get done. He obviously wasn't in a position to do it for himself. And so I think the preparation would be helpful. But one of the things that I really advocate for is if there was a way to have some people who could just regularly be in the home to support you, because in fact, you're not a medical professional, and your loved one doesn't want to be and doesn't need to be in a hospital all the time. But having some additional supports in the home would be incredibly helpful, even if they prepare you, just so that you feel like, given the context of your home and given the context of your lives, maybe there are things that they see once they're there in your home, helping you out and providing supports that can make your life and your loved one's life a little easier.
Thank you so much for adding that, Abina. When we see a couple of things that are not reflected on this slide from our research. One is that we ask, in addition to, did you receive preparation or training for doing these medical and nursing tasks? Did a healthcare professional ask you about what you needed to take care of yourself? And to keep your health and well-being? And that number is even lower. I can look it up, but I think it's like at the 10 to 20%. So it's a very low, very, very low number. The other thing that we see is in preparation, when some health systems may have the infrastructure, may have a training program, one of two things could happen. One, that the training comes at the beginning of the journey, when the caregiver and the patient has just received the diagnosis, and so it's like information overload of here's the diagnosis, here's how your life is going to change, and here's education on how to deal with this. And so we're big proponents of not only assessment of the caregiver needs, but also continuous and routine assessment to be matched with adequate support, so that training, education, and support just doesn't happen at the beginning of the journey, but rather throughout, and really matching the needs of the family.
And Yadira, Claire has a question in the chat.
Thank you for highlighting that for me. Yes, so for these activities is a set of the data is from the Caregiving in the U.S. report, and it's a secondary analysis. And in the Caregiving in the U.S. report, we ask about activities of daily living, instrumental activities of daily living, and then we ask about coordinating care. And so it's different, it's all of those different tasks that are being added, and how many hours are you putting towards those tasks. I see here in your question, in the second part of the question is, I don't think that we do in the survey, we look at the amount of time that's spent for, helping the caregiver manage and cope with everything that's happening, like the time in the support group. And that's a really interesting question. So I'm going to think a little bit more, but I want to say that it is not reflected. It is definitely not reflected on the hours graph that I showed you, because that's all of the tasks that are being done for the caring of the person. And so they're not reflective of what the caregiver is doing to care for themselves. That's a really, thank you for posing that question. And so this is, there's many needs of the cancer caregiver. And at NAC, we really wanted to tackle this issue and address the unmet needs of cancer caregivers. And that is a big issue to tackle. And so what we decided to focus on is cancer training, training support, and financial relief. Through our research and others' research, this is the area where we think are some of the biggest needs, but also, the biggest opportunities. We have, so here you see your history. We actually started we convened a multi-sector group back in October of 2023 and began to talk about what are the top caregiving issues. And through that, went through a process of really identifying 2 core priorities, which I'll talk about next, and really making sure that we kept the caregiver and the caregiver perspective in the forefront. So what does it look like? What does this experience look like for the caregiver, and where is there an opportunity again to act? We have an executive committee and an executive committee of 8 individuals that represent patient advocacy, research, caregivers, and industry partners, as well as I mentioned researchers already. So it's a diverse group. And we also have a steering committee representative of all of those different groups that are working on this issue together, because again, one organization or one individual can't do it all. And so here are the priorities that we have set out for ourselves. So NAC has had a long history of really advocating for the integration of family caregivers into care teams. We know that family caregivers are the backbone both of the healthcare system and of long-term services. And so this is really aimed at how do we get caregivers recognized in a way that they are being included in conversations and decisions. But not only that, that there is a way for the healthcare system to really provide the training, support, and education that they need. And then the second one is around financial, and we define caregiver training supports as comprehensive education, training, psychosocial supports, and information and referral linkages. And again, because this is a big task, we are really keyed into the recent CMS changes that allow caregiver training to be part of Medicare's physician fee schedule as one of the pathways to providing the training and support that caregivers need directly. So I could talk a little bit more about that if there's any questions. And then on the financial front, we're championing financial policies, practices, and programs that broadly provide financial assistance to family caregivers alongside care recipients that promote financial stability throughout the life of caregivers. So on the NAC side, some of those policies are like caregiver tax credits, paid family leave, and paid leave as some of those policies at the national level. And here we list our strategies as well as our activities. I want to highlight two activities. One of them, which Avina had, really had a big hand in, and one was that in the summer, I want to say in June, maybe in July, we learned that the Consumer Financial Protections Bureau had was proposing a change to remove medical debt from a person's credit history and had opened a comment period on it. And so we were sitting in one of our meetings and, saying, should we take this opportunity to talk about for the Cancer Collaborative, should we take action, basically? And it led, the details are a little bit murky, but Avina was really adamant about, and again, used her story and her experience about how medical debt had impacted her and her family, and said, this is an issue that we really need to take action on. And so that really prompted us to activate our steering committee and say, we're writing this letter. What data do we need to put in here? What are some of the research that we need to highlight? What are some of the stories that we need to highlight? And really drafted a powerful letter to the Consumer Financial Protections Bureau. And one of the wins of that is that then the Bureau said, we want to learn a little bit more about how medical debt impacts widows. And cancer being one of the examples that they were using. And I want to say, hearing from not only NAC, but other stakeholders. And I saw you came on the screen, so I'll let you chime in.
Yeah, so, for me, my role on the committee, I feel like, is sometimes simplifying some of the things that matter. Because I think there are times where we really want to elevate our thinking around, what should we be asking for? What should be possible? And in the end, when my family was going through this, the things that I needed were quite basic, right? Like someone to help me care for my husband in my home, someone to, like, the very first year my husband went through treatment, the only reason we were able to get through it was because his friends committed to bringing us dinner twice a week for an entire year, right? And, things like caring for the baby or all of the bills that were coming in, right? How do we manage that? I remember after he passed away, in addition to grief, it was all these bills kept coming, and trying to figure out how do I address this, administratively, but also financially in a way where I know my children and I are actually going to be okay, right? Those things seem really simple and really basic, and often they're the things that have the greatest impact. And the financial piece, it can hit you really quickly that you have no money and you've experienced this loss and the bills keep coming. And, medical bankruptcy is significant in the US. And especially when there's someone left behind, the widow, the children, etc. We all should have an interest in helping their situation not be any worse than it already is. And so that's why I really pushed for this, because I think it's one of those things that gets forgotten. And in the moment when things are happening, you're paying for the medication because you've got to pay for it. That's what your loved one needs. You're buying food at the hospital because you have to. You're paying for extra childcare because you have to. Hospitalizations, you have to, right? So these are things that, you don't have the option to think about in the moment, but have huge financial implications for your family afterward. And so it felt really important to me to bring up this topic and push for the committee to bring some additional light to it. So I appreciate you guys listening.
Thank you, Abina. And I won't share my slides again because there was just two more. And one was around sharing what's coming up next for the collaborative. And so we're going to be launching a peer learning and advocacy network next year, focused on both these two things, the financial relief and the integration of family caregivers into care teams. And so I encourage you, if you're interested in learning more about that, please reach out to me. And I'm happy to share more information on that. We're really keen in, again, into the implementation of the Caregiver Training Services Code that CMS introduced this year. The other example that I wanted to highlight is that for the first time they were introduced, the CMS billing codes for caregiver training services were introduced in 2023 to be effective in 2024. So this is like our first year that we have them. And we also did an advocacy activity where we had listening sessions with our steering committee about the changes for 2025. And again, went through the process of listening to our steering committee members and asking about like, how do the caregiver training services advance our mission of addressing the needs of cancer caregivers? What kind of training, education, and support is needed for cancer caregivers? And really, again, wrote another letter to CMS on these efforts. And so that's a piece of our advocacy. We want to serve up opportunities for those in healthcare, in research, and saying like, how can we elevate your research? How do we drive this point, and what are the things that we're really missing? And so work really collaboratively in that way. We're going to start. NAG also has a history of collecting and recording caregiver stories, and so we want to continue to do that, and really key into the caregiver stories that key into financial relief and being part of a caregiver team. And what does that mean? The caregiver being part of the healthcare team. And then we are updating, I already mentioned this, our Caregiving in the US report for 2025. And we want to conduct the same cancer caregiving report where we look at 2025 data. And then we also look at the data from 2015. And so really contributing to the research on this topic. So with that, I'll stop. I'll share my contact information in the chat box, but really wanting to hear about any questions, reactions, thoughts on this caregiving issue, and really appreciate you all joining Abina and I this morning.
Wow, thank you, Yadira and Abina, sharing what NCA does and your experience, Abina, is just so powerful and something that we need to pay more attention to. I really love all the educational and advocacy efforts that your organization is involved in. It's really fantastic. Does anyone else have any comments or questions? Did we answer everything in the chat? Everyone's just thanking you for your story, Abina. It was really powerful, really important to hear all of that.
Thank you for letting me share it.
Yeah, big time for sure. Anyone else that have a similar story you want to share? You know, this is the time, this is the forum. So I know a lot of people are affected by this and, have a connection to this. Yadira, do you have a connection to this, like a personal story that has influenced your participation?
Not to cancer in particular, but for me, caregiving issues. My family migrated here to Chicago. I'm actually local. I work remotely for NAC. When I was a young girl. And so as an immigrant family that didn't have health insurance, didn't speak the language, and had to learn how to navigate the system, I think a lot of the caregiving roles were for good or bad, assigned to me as like the middle kid. I was like the health kid, and continue now I'm like the adult that helps with all health issues of my parents. And so I view caregiving in that way, where there is a lot of family support, and some of us who needed to step up to keep our family healthy and make decisions about their health and their well-being. And I also foresee that in my future, with my parents getting older. I think it's there's a really famous quote that is shared a lot in the caregiving space about that there's only four types of people, like those who are caregivers, who are going to be, and who are going to need caregiving. Oh, three types of people. And so I think that the universality of caregiving is so important to highlight, that it's not, those people, that it's actually all of us who are going to be a caregiver or need a caregiver.
Right. And to your point, too, highlighting also something that Abina said that I think about a lot, about how being a privileged family, this is how it has been, but thinking about those less fortunate and how much harder it is, and when patients and people have no support. It's an important population to try to reach out to and help. Luis, you have a question?
Could I just point out, I think, Claire, did you want to, you unmuted, did you want to share something?
Oh, yeah, Claire.
Oh, I was thinking so much about how when hospice gets involved, it's like this major transition so much of the time. And in my family's case, when my father-in-law's, when hospice finally became involved, it was like all these kind of windows opened, and there was like this freshness of like, oh yeah, like, and his demeanor lifted because things were just easier. The sort of access to pain relief got so much easier. And I wish that there wasn't such a, I don't want to call it a stigma exactly, but like sort of an idea of hospice as being kind of only for this very last, couple of weeks. Like, I think in many cases it can be useful to have hospice consultations, even, before that very end stage, just to kind of frame how we're thinking about care, both on the medical and on the sort of social, psychological, and spiritual level.
Thank you for pointing that out. There's so much ways to go in doing that. For the Cancer Caregiving Collaborative, we have one of our steering committee members is the Shirley. It's in California. Gosh, I'm blanking out on the name, but it's a palliative and hospice organization, and a really big proponent of how are we looking at the caregiver, at the Cancer Caregiving Collaborative's work, and really being inclusive of palliative and hospice care, given the fact that it's so present and so helpful in many spaces, but in particular in cancer.
Luis, did you have a question? Is he still here?
Yeah, so not so, well, I guess there is a little bit of a question, but I just really wanted to thank everyone for their presentation and, sharing your stories. I think this is a very, very important topic, and one that, it hits pretty close to home to me. My mother, who's passed now, spent many years taking care of my father with Parkinson's disease, and he had entered hospice care for the last year's life. And then, but actually before my father passed away, my younger brother was diagnosed with renal cell carcinoma. And she was I saw the toll that taking care of my father, which was a full-time job, took on her, and just seeing how few resources are for caregivers. And then once my brother was sick, and she was also the main one taking care of him as well, and you just entered another level of, just difficulty for her. And, obviously everything you said about, obviously you're trying to, you deal with the grief of your loved one having cancer and then take care of them and other things surrounding, their care. And it's just so difficult. And there's just such few resources for patients. And then, my brother, and I know there is this things in general in our society, and especially in the Latino community. I think there's a little stigma with people entering hospice care. I know my mother sometimes thought it was like, oh, like my brother goes into hospice care. She felt like it was like we were giving up or something. But I also felt like there was also like hesitancy on his oncologist to recommend it, even though the prognosis was not very good. And I don't know, there's just some data on how often like Latino patients, for instance, are offered hospice care or at least consultation, because at that time I was in residency, and I just, I knew the prognosis was very good, but it seemed like the oncologist was always like really hesitant to say in the word hospice, and I was just really shocked because I thought that was something that they're doing somewhat regularly, and when he, finally, things got pretty bad, and, it looked, this deteriorate further, the college just finally, recommended hospice care. And my brother was on, and my mom got a lot more support, but he's only in hospice care for a week. He passed away after being a week in hospice care, and I just really wish he would have been able to get that level of care earlier, and my mom would have been able to get that support earlier. Thank you all for sharing. Really appreciate it.
Thank you, Luis, for sharing that.
And I know that we're at time, but I'd just like to add one comment to what Luis just said. That stigma is so very real. I'm glad that Claire talked about it as well. And to me, it leads to so much more suffering for families than they need to go through. I wish that there'd been a lot less stigma around it too. And I frankly had to fight my husband's parents when it was time for him to come home for hospice. Because it does feel like you're giving up in your person. I think the more of these stories that we share, the more that we have these conversations, the more people will understand that hospice is not you basically writing off your loved one, that in fact it's the most loving and caring thing that you can do for them. And people can go into hospice, and if they're better, they can come out of hospice. It's not a you go in and that's the end kind of thing. So thank you both for highlighting it. I think much more needs to be discussed about this to help people out. So thanks.
Yeah, I look forward to seeing all your great work and collaborating hopefully with you guys. So let's stay in touch. Thank you everyone for coming this morning. And thank you our speakers, Yadira and Avina.
Thank you so much for having us.
Have a great day, everyone. Bye.